This patient we are planning for upper rehabilitation. The bone looks good in the panoramic view, but actually the bone is very thin in the anterior region, the 1112 area. If you see, the ridge is very thin. It is thin around. It is around 3 mm. So in the 2-2 area also the ridge is very thin, around 2 mm. However, the ridge width is good in 2-4 area. 2-5 there is no bone. This is 1-3. 1-3 also ridge is very thin. 1-4 is okay. 1-5 is very good. In 6-7 region bilaterally there is no bone. Both side pterygoid is good. This is the left side pterygoid. Left side pterygoid is also good. Okay, so the challenges here is anteriorly the ridge is very thin and there is no bone in the 6-7 region and also in the 2-5 region. So bilateral pterygoid and anteriorly few implants. Anteriorly we have planned for only 4 implants, but we have placed one additional, getting transnasal technique. We will see the pterygoid first. This is the right side pterygoid. So if you can see, this is the tuberosity bone, this is the pterygoid bone, this is the junction, the implant is going to it. The length, this is a compressive implant, multi-unit compressive, around 16 mm, 3.75 into 16. This is the left side pterygoid, you will see. Okay, little bit extending into the space, the tip. This is also 3.75 into 16. We will see the right side premolar implant. This is 3.75 into probably 18. Oh, yes, it is around 18. Getting engagement from the nasal floor also. This is in the 1-2 region where the ridge is very thin. We did palatal approach technique or alveolar bypass. So this is the crest, but we drilled palatal to the crest. So these 3-4 threads of the implant will be exposed. They are not surrounded by bone on the palatal aspect, but it will be covered with a thick palatal tissue, so no issues. This palatal approach technique is used in both basal and conventional, or you can say both in single piece and 2-piece implant. The 2-2 implant is also thin ridge area where we did palatal approach. We can see these threads are exposed. Bypassing the crest, we have placed the implant, getting engagement from the nasal floor also. This is 2-3 implant, 2-3 around, yes, 2-3 implant also we did almost like a bypass kind of thing, getting engagement from the nasal floor. We can see this radiolucency. This is canaliculus cynosus. This is a normal anatomy. And this is the implant we just tried, transnasal engagement. So crestally there is only 4 mm bone. It is going through the sinus and getting support from the lateral nasal wall. Just we have to take another X-ray after a few months, then only we will know what is the long-term impact of this technique. So totally 7 implants. We'll see the axial section. Axial section to see the pterygoids. So this is the pterygoid junction, lateral pterygoid, medial pterygoid, and both sides the pterygoid is coming in the correct position. We can appreciate the palatal bypass technique.